So I'm going to do my best to really say what's reality of what you can do. Even CDC goes into the process of you have a little bit of your own ownership of we can't track everything. Okay, even CDC, CDPHE cannot track everything. So we have to. There's a bit of an honor system in that. How do you follow through well? Similar to dress code with everything, it's ongoing, and people are going to do their best, but it's not going to be perfect. The positive that you find right now, Omicron, and hearing it, this is what I am hearing from health advisors, even today, CEOs, 2 different hospitals, representation from hospitals. Omicron is showing to be less serious. That's a good thing. Positivity is up, severity is not as serious. But I also would say it's probably not exact in that, right? So we have to look at each individual situation and go through that. But I think you look at trending, you listen to what's happening. We are working with our Douglas County Health Department, and they are continuing to partner with us. The role of a health department, any local health department, is to take from federal level to state level to then your local level and put that in place. But it's also we're working with our neighboring superintendents. They too are finding the same thing. Reality, even with universal masking, at any time in which you've done it, it's not perfect. With masking and now coming back, or with not masking and now coming back to request a mask, it's not going to be perfect. I've had questions of, how are you going to separate in a lunchroom? You can't always do that. Can you have people eat in classrooms? You can't always do that. Even in all places, if you have every grade level class eating in a classroom, when are teachers going to eat? Because you can't get the supervision in each of those classrooms. So reality of what you can actually put in place and do. We don't want to sacrifice safety, but you also have to say, what are the mitigating factors that work best? And kids are eating lunch together regardless, and sometimes it's asymptomatic, and COVID variants are changing. There's not a perfect exact answer, and it's probably not what anybody wants to hear, but I will say we'll continue to monitor. If you see a drastic increase or change, if there's a different variant, or you see a different level of impact, we're going to have to adjust. We're going to have to come back and say, here's our reality. So I think current states, we're tracking that data. We had a bit of a process going into winter break, but I'd also say Omicron now is the dominant variant, and you see that side. So I think we are now at a new spot we're monitoring and going through. We have other things in place, mitigating factors, but it's going to have to be an ongoing piece. But I do think we have a good plan. We have a good work going ahead. People are responding pretty well with that. Staff and students are responding right now, and we're going to continue to respond. Let's see where we get to at the end of February, or end of January, where we're in middle of February, into February, because there is modeling and projections going out of what could happen, and is not going to say that's going to be exact what happens here in Douglas County or in our state or whatever else. But I think you have to take from what you've learned from others and also build on what are we experiencing and adjust. So that's trying to put some true reality in place and just being, I'll pass it over.